Thank you. It's a real pleasure to be in a part of the country that's sane. And I want to definitely bring you greetings from the Illinois Public Health Association. In our great state of Illinois, we have at least a $15 billion deficit. I actually think it's more. Our legislators can't count very well. And that represents about 35 or 40% of our operating budget. It's not unusual news. And I want to remember to do this early, because I do have a commercial. And I know that Bob's coming. Who else is coming to Chicago?
Hunt Blair is not here today.
Okay. We will be having an unusual mid-year meeting this year, June 23rd to 25th in Chicago. Not just APHA, but NACCHO and ASTO and every other national public health organization that you can think of. We're going to be gathering in Chicago to consider the plight of the Affordable Care Act. And considering how much it's under attack, it's even more critical that we come there. And so if you're wandering around and feel like coming to a great city in June, just drop by and join us. This week, in fact Monday, I started National Public Health Week in my hometown of Cleveland. And this week represents the 43rd anniversary since the Reverend Dr. Martin Luther King was assassinated in Memphis. And I thought it was important when we're looking at injury prevention as our theme for National Public Health Week to consider that important anniversary for our nation. And we contemplate what we need to be doing going forward. While we're engaged in 2.5 wars, I think it's 2.5, I've lost count, that we're not paying for, war still remains the largest, in terms of numbers, cause of injury and death in the world. And we shouldn't forget that. But there are other important anniversaries this year. This is the 150th year since the start of the American Civil War. For me, at least, an important public health anniversary to remember. What would have happened if that event had not occurred? Where would I, in fact, be? It's the 100th anniversary of the infamous Triangle Shirtwaist Fire that took place in New York City, where immigrant workers, many of whom I'm willing to bet did not have documents, most of young women from Eastern Europe, came to work in a classic sweatshop sewing dress shirts of the day for gentlemen, and were routinely locked in their factories when they came to work so they wouldn't steal cloth and would not take breaks. And so when that fire broke out, 146 workers died. An anniversary that is really close because it's only a few years ago that we had to file suit against Walmart for locking the door on their third shift workers in their stores and warehouses. This is the 40th anniversary year of the establishment of OSHA and NIOSH, two organizations that are dedicated to making our workplaces safe. And there's no question that their work over the past decades has saved tens of thousands of lives. But still, both organizations are crippled and unable to carry out their mission completely. So even though it's easy at this time of year, especially when we look at National Public Health Week, we gather together and we do activities that make us feel good, and we get a few press stories in our local papers, and people think about public health for a moment. It's important that we understand how critical these anniversaries are. And it's also important that we remember how difficult the situation is in the nation. Half an ocean away, the people of Japan are grappling with environmental dangers and problems, and we still don't know what's going to be the outcome of that. We all watched together the Chilean miners and the Gulf oil disaster, so the challenges that face us as public health professionals are real and often global in scale. And then we're faced with our more mundane problems at home. More than 20% of state and local health departments have had to face significant cuts in their budget. Layoffs, or as I call it, early retirement, which are really layoffs too. Furlough days. The city of Chicago, not the most healthiest place in the world, has 22 furlough days. That's a full working month for the city. My own department is just scheduling 10 furlough days between now and November 30th. So we are a field that is under attack. And in addition to our normal inferiority complex, we have real problems. I'm really excited and looking forward to tomorrow because, and I have a confession to make, because I thought we had done a good job of education and communication, but it seems we slipped a little bit. Trust me that a young man from Illinois used to understand that single payer was the right way to go. He publicly supported single payer. We did our job. And I'm really looking forward to having a discussion with you tonight and with your leaders tomorrow about how Vermont is going to approach this critical step that has to happen if we're going to make any progress on health care. So, every place I go, people talk about the cuts that are coming. And it's not only what cuts, but they're coming. In fact, I get calls nowadays and I have to ask them, is that cut in the Republican proposal or is that cut in the administration's proposal? Because they're cuts from our friends. What does it mean to eliminate Title X funding, family planning funding in this country? This is a disaster, especially for our young people. What have we done or not done? How did we end up in this mess? I didn't do drugs during the 60s, and I think I'm having flashbacks. My youngest granddaughter, when she was 6 years old, gave me an important lesson. And like all grandmothers and most adults, when I see my granddaughters, I always ask them, what did you do in school today? And they always say, nothing. And one day I asked T.Y., what did you do in school today, baby? And she actually stopped and looked at me. And she said, did you know that eggs were dead baby chickens? And I said, well, yes, baby, I do that. And then she got a real suspicious look on her face, and she put her hands on her hips, and she said, and did you know that we used to be slaves? And I swallowed and said, yes, baby, I knew that too. And she pointed her finger at me and she said, you're supposed to tell us the important stuff. Now, like any good grandmother, who's basically a public health worker, I told her, wash your hands, cover your mouth when you sneeze, eat your vegetables, brush your teeth. But how could I have failed to tell her the important stuff? She was already 6. She wasn't too young. What we have done in public health is we fail to talk about the important stuff. We get confused. Well, actually, we don't really get confused. It's easier to talk about those other things. It's not that it's unimportant, but it's easier not to bring to our communities the important information. I was happy last night as I was looking at the report on the web to see that the Vermont Health Department had issued a great report on health inequity. Because what this report says, it's not, you all already knew, I mean I didn't know, but you all already knew what parts of your state had health problems. And this wasn't a surprise. But the real value of that kind of report is it shows so clearly for so many different things that ladder of health status. It's not remarkable, I think, to me, or I think even my granddaughter wouldn't be surprised that poor people were less healthy than rich people. Any idiot knows that. The remarkable thing is that not so poor people are less healthy than middle class people. And that middle class people are less healthy than upper middle class people. The really remarkable, powerful thing is that health inequities represent the stratification, the injustice in our society. And while we are not all impacted by that injustice in equal measures, we are all impacted. And that's why the lessons of Vermont become so powerful and important. If there were no people of color in the state, there would still be some health inequities in the state. And what people have to understand, which is the important stuff that we have to find ways to talk about, is what we know keeps people healthy. We all go to school, and if we teach, we tell it to our students, and it occurred in some class or other, somewhere. We know that the health of people is determined, not influenced, not sort of nudged, determined by social conditions. But how often do we say that? How often do we structure the work of our health departments as though that were true? We have to stop being so concerned about how public health and prevention gets the short shrift. We have to understand that to the extent that we can connect what we do in public health with what we do in clinical medicine, we have more resources, we have more focus. Clinical medicine, while I know it makes a lot of money, it gets all the press, it's really only a small and relatively unimportant part of what keeps people healthy. It's critical, though, when you need it. When you have that appendix that's about to burst, you need a surgeon. But it's the interaction between us as individuals and the social environment that we swim in that really determines not only the health of populations, but the health of individuals. We have to say clearly that if you want a state or a county or a community or a family to be healthy, you got to have jobs. Not just any job. Jobs that are safe. Jobs that pay a living wage. Jobs that treat workers with dignity. In the past 40 years, the income gap and the wealth gap in this country has escalated. We now have gaps that rival the 1920s, right before the Great Depression. We need to speak that clearly. But we continue to give tax breaks to the rich and cut social supports for working people. In fact, we need to stop talking about the middle class. We need to teach some basic arithmetic. Everybody is not in the middle. We're talking about workers. Most people in this country work for a living. And it's them that are under attack. We shouldn't be debating minimum wage. We should be debating livable wages. That's the important stuff. Housing. We know the social determinants. You have to have secure, safe, reliable housing. As you saw the foreclosure crisis grow and the stories covered on the evening news, where were public health leaders saying, this is a public health emergency? Do you know what happens in a neighborhood when foreclosures go up? It doesn't take very many. It's not like half the houses have to be foreclosed. Let 2 or 3 houses on the block be boarded up. And what happens? The foreclosure crisis represents the largest single loss of wealth for Black and Latino families in the history of the nation. A public health crisis. Education. In my city, we're often concerned about youth violence. It's a major problem. When we allow our children to be murdered and murder each other. But what concerns me, because the really important stuff is the violence we do against youth. What does it mean when you have a child that stays in school to the 9th, 10th, 11th grade and they cannot read? That's violence that we've committed as adults against those children. What does it mean when you go to a school and the ceiling leaks? Or in a Chicago neighborhood, University of Chicago did a study and found that for every 100 black boys that started kindergarten, only 3 would have a bachelor's degree by the age of 25. Violence. And our youth are normal, intelligent young people. And when we commit violence against them, whether it's telling them, go to the army before you can go to college, they strike back in ways we're familiar with. Some people find it ironic that poor people have the most food insecurity and hunger and have the highest rates of obesity. I don't think it's ironic. I think it's perfectly predictable. We understand how that happens. And when we talk about healthy diets, that's not enough. We have to talk about healthy, sustainable food systems. Systems that allow people that live in rural communities that produce our food to make a living wage and to have a secure income. Systems that allow people that work in the food industry to be paid correctly and not have starvation wages. And yes, systems that bring to the tables of every American healthy choices. And I shouldn't even mention this, but I will acknowledge it because I'm in what I think is the most exciting part of the country. Medical care is a social determinant of health. Who gets it, how much they get it, what it costs are socially determined. That's why the rest of the country is swimming backwards, and Vermont is our only state that's trying to go forward. But the notion that in this country, and while I haven't seen my good friend Barack for a while, the fact that in this country we would have a national piece of legislation, however important it is, and don't get me wrong, I think the Affordable Care Act is an important step forward. A baby step, but an important step nonetheless. But to write a piece of legislation that explicitly makes it clear that men and women who come to this country work in the lowest paying jobs, in the most dangerous conditions, pay their taxes, would be excluded from coverage under this bill simply because they were here without documents. It's unconscionable. Healthcare is a human right, and we have to demand that our nation act like it. So we stand here today in a new century as people who care about the health of the public. And I, at least, find myself fighting battles over and over again that I thought we had won 40 years ago and 35 years ago. So what happened? How did we get to this state? My sociology friends, I'm only a doctor. I don't understand all of this. Just my sociology friends tell me that the label they put on this new think that Americans have swallowed is called neoliberal ideology, which confused me because I didn't think it was liberal at all. They explained to me that that's not what neoliberal meant. It's an ideology that's rooted in American values. It's an ideology that says that the individual is important. This is a core American value. And we have to pay attention and honor and respect the individual. But somehow that's gotten perverted. Not by accident, in my opinion. That we raise the honoring of the individual to the status of a religion. A dogma. No critical thought. If the individual is everything, then, to quote Star Trek, collective action is futile. If the individual is everything, then if you're poor or marginalized or fat, you did something wrong. It's on you. Nothing else is important. And by corollary, if you're well-to-do and rich, you did something right. The only right thing most rich people do is choose their parents wisely. It follows from this ideology that collective action is futile, and then certainly government is useless. Because for better or worse, that is the highest, most organized expression of our collective will. And I must say we've had some challenges of late. Government is useless. That's how you can get senior citizens in this country passionate about protecting their health care, shouting from the seats, keep government out of my Medicare. Government action is futile, and then, friends, public health is futile. Not simply governmental public health, but all public health. And most public health in this country is not seated in government halls. Most public health is done by school systems and voluntary organizations and clinicians and housing departments. Public health becomes useless and futile. I think this is because we fail to remember and talk about the important stuff. Public health is about social justice. They are synonymous. You cannot have one without the other. Not if you understand what we know to cause disease. The forces that stratify us as a people have to be addressed head on. Racism. Racial and ethnic disparities occur because of an unjust situation that stratifies resources and opportunities. Class. Call it what it is. If you're more comfortable with social economics, that class determines what happens to you in this country. Gender. These are the three, they're not the only ones, these are the three major mechanisms through which injustice works in our nation. If we cannot call out what's making us sick, then we have no hope of closing the gap on health inequities. Inequities, not disparities. This gentleman and I have health disparities. I have a uterus, I don't think he does. That's a disparity. Health inequities are things that occur that are avoidable, that don't have to occur, and that are not right and fair. Americans understand fairness. They get confused and misled. If they listen to Glenn Beck, they really can. But people know it's not right that your health status be determined by the income of your parents at your birth. But it's predictable. Your health status shouldn't be determined by what zip code you live in. But the nature of class and racial segregation in this country is such that it does determine it. We did not accomplish what we've accomplished in public health in the United States by failing to attack injustice. By calling for social justice and by linking our day-to-day work with social justice movements is how we doubled the life expectancy in America in 100 years, between 1850 and 1950. It didn't happen by accident. It happened by speaking out and standing up for justice. Social justice is what insisted that sewer systems be put in our cities. Social justice insisted that you shouldn't get sick from drinking water and demanded that people have clean water. Social justice is what called public health leaders to try to eliminate the slums in our cities and to fight for the health and safety of workers. It's not right that your ability to survive high blood pressure or diabetes be determined by the color of your skin or your gender. I think we in public health have retreated from what we know to be true, really starting with World War II. That we began to soften what we say. That we made a distinction between keeping a job working for a governor or a mayor or a county commissioner with what we're really supposed to do, with what our real job was, with what really is important. And you know, there's a way to talk about this stuff and still keep your job. I'll come here and yell at your governor. You can go to Illinois and yell at mine. That's what APHA is for. We retreated to safer technocratic areas, vital records, communicable diseases, labs. We even continued the paternalistic tradition of our field. Wash your hands, eat 5 a day. One of my patients came in, they were so excited. We put up the 5-a-day signs. And he comes in, we're in the exam room, and he says, "Doc, what's that new sign, eat 5 a day?" And I said, "Yeah, we're trying to get people to eat healthy." He says, "Oh, that's great. I didn't know I could eat 5 times a day." I think people in this room know from your own everyday experience what's possible with community. The real challenge is making community with someone 500 miles away, or 1,000 miles away, or 1,500 miles away. The real challenge we have is taking our successes and our history and our passion and making it concrete for people. That's what I liked about your report so much. So that some white person living in rural northeastern part of the state understands that health inequity is about them, in addition to the newest African immigrant. Equity and social justice is not a supplement to public health. It is the heart and soul of public health. And we have to lift our voices again, more loudly this time, more in tune with each other against racism. We have to insist that the fact that organized labor has dropped below 10% is one reason why we're in trouble in this country. I was in Wisconsin a few weeks ago, another white state. Not as white as Vermont, but you know, I always get nervous when I go up there. I went up there, I felt called to go up there, and there were a few people from Milwaukee, but mostly it was like Wisconsin. 150,000 ordinary white people. That's what I did when I went home. I said, "Did you know there were 150,000 mad white people in Madison, Wisconsin? And they're not mad at us?" They understood in a concrete, now they just elected that idiot, so they understood in a concrete way what it meant to begin to lose the social conditions that allowed that state to be healthy. And they were mad. They weren't all government workers, they weren't all teachers, but they were angry. We allow the President of the United States to have a council of economic advisors. And everybody pays attention to who's on that council and what they say. Why don't we insist that the President have a council of social advisors? Those are more important. That's the advice that we really need if we want to make progress in this country. The World Health Organization, I think a relatively mainstream, conservative, international public health organization, issued their landmark report in 2008 called Closing the Gap on Health Inequities in the World. It's a wonderful outline of how to address these issues. But what startled me was that this conservative organization argued that in the world, rich countries, poor countries, they felt they could close the gap. They could eliminate health inequities in a generation. A remarkable feat. As an American, I couldn't imagine. But what that report also said is that that gap killed millions of people. These inequities kill millions of Americans. Some slowly and some quickly. And it is our job as public health leaders, our job as WIC nutritionists, our job as the visiting nurse, to stand up and say what we know is the important stuff. If you want the United States to be healthy, then we must fight for a just society. When we do that, we will eliminate these health inequities. Thank you.